It is 8:30 or so. I call this meeting to order. First item on our agenda is the public comment. Are there any public comments related to any items on our agenda? Are there any comments?
I see, okay.
Nobody's in the meeting.
Are there any comments? You did it 3 times. Why'd you do anything?
Yeah, over here. I'm just happy to be here.
Okay,
Hey, that's right.
moving on. It'll be noted, Connor was happy to be here.
Put that in the minutes, would you, Shannon?
Okay.
Okay.
Next item is to, well, first of all, just acknowledge the minutes from June the 5th.
So,
Second.
Moved by Sanquist, second by Dimmitt, all in favor?
Aye.
Meet with the county engineer, I believe it's Dwayne Hines today.
Good morning, supervisors, and yes, today I am Dwayne Hines.
All right,
And much like Connor, I am happy to be here.
thank you.
The road department will be working on Fruitwood north of 200. There's a pond outflow there that was installed back in the 80s and the pipe has deteriorated to the point that we need to replace it. I think we're getting 50%. I know we're getting 50% funding through Sitka on that. So the county's outlay, that's going to be around 14,000 and then 14,000 match from the Pathfinder Sitka group. Let's see, we met with the railroad on a Teams meeting and the crew's doing the work. And that is $800 a foot per set of rails. So each crossing, if you want to upgrade from timber to concrete, is $51,000. And coincidentally, if you applied for the DOT grant with the 80-20 match, then you would be 20% of the full cost. That also is $51,200. Coincidence? Maybe, I don't know. But so that's, you know, if they do the timbers, it costs us nothing. If we want to increase.
well, I'd like to at least see Quint's done, as we talked about previously, just because it gets a lot of traffic.
So that's
Redwood could use it, but it doesn't get as much traffic. But the thing is, this is like at the 15-year deal, so it'd be nice to be able to just take care of it.
So
When would this come out of next year's budget or this year's?
it would come out of 2024.
So to refresh our minds, we have voted already to do the one. Although I think it's quite expensive.
But that was
A different dollar.
That was
42.
when it was assumed it was $25,000, not $50,000. 51,200. Basically, the cost is double from
Yeah, I see
what you guys had considered.
Just my comment.
Well, I would recommend you go out and drive on the plane. And decide.
Yes, we don't, again, they will be in town and in the county pretty much all summer. So you do not need to make a snap decision on it, but
Okay.
it would be nice to have a decision to them by the end of June.
I'd like to know, it's ironic that you bring this, not ironic, but as I was coming in this morning, all these crossings blocking, not doing a damn thing. Don't see anybody up there. You can't get through town. It's like, yeah, we'll just put up the barricades.
I can help you get back home. Okay.
Okay, thank you. I appreciate that. I don't know, it just, I think this is thievery, but I think you.
I think that those are supposed to be taken down around the 17th, if I remember correctly from the press release.
I'm talking about the $51,000.
All that too.
That's the truth of the matter is they probably got the damn concrete sitting there anyway.
Well, fact is, they told us a few years ago they were gonna do concrete and never told us that, so.
They tell us a lot of things.
So I think what I'm hearing is this is an ongoing discussion and we all need to go out with those tracks. Okay.
If I remember from last week, we just briefly touched on the Batavia shed. You guys want us, as Patrick, if you want us to proceed with drawing up a request for quote or request for bids for.
When do you
Something.
anticipate that will be ready to be?
I hope by the end of July we'll have that ready to be done, but
Well, I guess my opinion is based on how the bid process moves. You know, there've been turtles passing it, but maybe we should sooner than later. That's as far as the bid process.
And we would, and I'm asking this, so would we put in the bid a specific remove by date?
Oh, I would think so.
yeah, because we don't want them to drag it on. I think we can be very generous with the time frame. Possibly actually till next spring if that. To provide, depending on who's doing it or what their work schedule is, to give them a big window. Because basically, generally, you get better pricing if you give them more latitude on when they can get the work done. So, and for our end of it, it would be nice if they could have it out by the end of August, and then we could have the seating and be done, but that's unrealistic. But if we could have it by the end of next March, then we could get the seating done in the spring, which is for our purposes, that's just fine. We're not pinched for space. It's not going to be a inconvenience to have it sitting there.
Which brings me was my second question. If we don't sell it, then
we have to pay somebody to take it down.
okay, so we're going to take it down.
Well, I think we have interest in people, or we've had people approach us on it.
Okay.
So I think at worst case, we can get it removed for free. At best case, we may get $1 or $2. At least that's our gut feeling right now. We may be wrong. We'll find out.
So what do you think? We should go ahead with this, put this up for bids, or at least have a sample to look at with how it's going to look?
Yeah,
Because we've got Elizabeth right here. She has nothing to do.
We've approached her. We've talked with some of the other counties that have done this, so we're basically going to steal their bid documents.
Sure.
And modify them to fit our purposes.
Mhm.
And I'll try and get that to you guys by next week so that we can publish it, get the copies to the auditor's office.
So before he does all that hard work, should we make a motion to do this?
We could, yeah. You want to? Okay.
Motion to do the bid process for selling the package shed.
Second.
All in favor, signify by saying aye.
Aye.
The next item on the agenda is discuss and consider resolution for re-subdivision of lots 5 and 6 Wild West Hills subdivision. We've talked about this for a while. I personally see no problems with it at this point.
And anything new? Just what we talked about. Okay, I make a motion that we approve this resolution. Re-subdivision of lots 5 and 6 Wild West Hills subdivision.
I'll second that motion.
I was going to have her say that 10 times real fast.
I know. I don't think she could have done it. We want to get out of here.
Just, I'll just tell you that I did some research. It doesn't trigger our subdivision ordinance,
Thank you.
in case you were curious.
Thank you.
Thanks. All those in favor?
Aye.
What do we got here? Meet with ambulance director.
I know. Thank you.
It's all warmed up for you.
Appreciate it. Yes. That's it. Good morning.
Morning, how are you?
Good. I.S. Connor. I'm happy to be here.
You guys are just being so kind today.
Such a lovely
I don't know.
moving weekend.
I don't know what's in your Kool-Aid, but
I even got my hair cut just to be here. Nice. Yeah. Happy retirement.
There you go.
I know. I know. Right. First of all, I want to thank Chris Testel for working on the NPI issue. I was able to, our NPI became available on Friday morning. I had to do it twice because I was like in disbelief. I was like,
Mhm.
oh, Lord.
That's
I got
great.
through it, right?
Yeah.
I think that's
So-
great.
I have our NPI number. I was able to get it the same day, so error-free.
So next
Yes.
steps, what, credentialing with all the companies?
Well, the next step is, yes, and that comes with our billing company. Our NPI number is complete. We are good to go with that. So next step is we met with Noreen with A&B, which is Andres Medical Billing Company out of Illinois. The reason that I met with them was
This talks about the GEMT.
correct. I went through Miles Brown. He is our state representative for the GEMT. Okay. He provided me 3 companies. A&B happens to be one of them, PCC, and the other one escapes me. But the reason I reached out to them was that they do have experience with the Iowa, because Medicaid is state by state. So Iowa's unique because it has its own Medicaid. So going through them would be a whole lot easier. What's A&B or PCC or any other company is that the interface with Miles and his company and getting us the GEOT. And so they also interface with, we're looking at image trend to be our interface for our patient reports and stuff like that. All 3 companies will interface with the image trends. So everything will be nice, decent, and in order. And they also will interface with the GEMT, which we have passed out. So in our discussions with A&B on Friday, we were looking at either going to a flat rate, which would be about $23 per call, or we can go to a percentage rate. And we don't know what that is currently right now. They are working out numbers.
So that'd be a percentage of what's billed that they would get.
That's correct.
Yeah.
And PCC and I haven't talked to them fully yet. We just had a brief discussion. We have another discussion set for Tuesday, tomorrow. PCC, as I know, will charge 6%.
That's
Okay.
normal.
And we don't know if we want to do a flat rate yet, but we're going to see what's going to be less expensive.
When I
during
was
that time.
researching that a few months ago, what I learned from the ambulance directors I talked to, they said if you do the percentage,
Right.
that the company has more incentive to bill, whereas the flat
Which-
rate, and I don't know,
yes.
you may have other experiences.
Yeah, with this company that he's talking, the A&B, we have to do that flat rate for us. I think it's like 6 months because we
Correct.
don't have, since we're new, we're just starting
Sure.
out.
Right.
And then we can reevaluate and see which one's gonna
Okay,
better benefit us to collect more revenue.
and they're
So-
okay with that?
Mhm.
Yes.
Yep.
Good.
We're currently working on our fiscal year budget. I spoke with Shannon and we're gonna have it to her by the 19th. So we're gonna be doing that this week.
I can give you what I've projected
Yeah, that'd be great.
for payroll. Now, mind you, this first sheet, I did variations on pay rates. The second one is everybody at the top dollar. And the first one is from October of this year to July 1st would be that amount. And then the one over here in the corner is for like 12 months. This is just for employees. And we're thinking $16 to $20 for EMTs and $22 to $27 for paramedic CCPs.
16 could you repeat that? Judy?
16 to 20 an hour for EMTs and 22 to 27 for paramedics / CCPs. That's pretty average around here. I know talking to Henry County and Washington County, they just did a bunch of pay increases. So they're way higher than what we are.
Yeah, they would.
But, you know, we have to go with what we can
Right.
do and what an average is. So
As far as the transports in 911, what we have seen over the past several years, that we do anywhere between 400 to 500 transports from the hospital a year. And about 1,500 or so 911 calls. So altogether, you're looking at about 1,900 to 2,000 calls a year. That's what we're looking at. We're going to be in negotiations with the hospital to get a transport agreement. We're already in the works for that. I've talked to Chauncey and we're looking at several ways of how to figure that out. So, and I'll have I should have something worked out for you by next meeting about what we're looking at with them. I am working on a pharmacy agreement with them. I talked to Brian Hunger and Stacy, and that's in the works, and I'll get one also. Our licensing agreement with the state, I am about 95% complete with that. Yes,
Wow.
ma'am. Yeah,
That's great.
that's, I'm just missing a couple of pieces, but I see those coming. I'm gonna meet with the medical director hopefully this week, and we'll finish our protocols, and having those protocols and the pharmacy agreement as well will complete our licensing agreement. I've already been, Jacob has been wonderful. I have been reaching out to him on a daily basis. So once that's complete, the only thing we have to add is the workshop that me and the medical director will attend, and that's July 13th at 6 and 9 o'clock, 3 hours. It's a Zoom.
That's what I was saying.
That's correct. It's a Zoom. So we'll get in the same room together to do the Zoom so we can work back and forth. And then we add the dates to our licensing agreement. We get that sent in. And now it was projected that licensing agreement with the state to get into the Amanda system online was 1 August. We're way ahead of that. So I again like to be proactive and get it done. Let's see what else. Again, the GEMT, and when we sat down with Noreen from A&B, you know, I learned a lot about what the GEMT offers. And it's not only based on the Medicaid system. Say that you know, Medicaid pays 47%. Well, GEMT, they come back and we get 53%, therefore making it a whole of 100%.
but they also take
But
in consideration these things.
That's right. It's also based off of our salaries, administration fees, maintenance for the vehicles. And the more we give them, the more GEMT money we get back. So, which is extremely low.
But we have to bill for 1 year before we can even
Correct.
get anything, so.
That's why, yeah, we know this first year, there's a lot of
Yeah.
startup.
Right. So, we've been running some rough figures, so, we're looking potentially for income, for stuff coming in anywhere between $800,000 $1 million a year is what we're looking at right now. And that could go up, as
Well,
we
yeah, we could
want.
bill for it after a few months, even though we won't have it yet. We'll know kind
Right.
of what this numbers would
Well-
be for when we get it.
The sooner we get the billing company on board, even though we don't start till 1 October, on the runs that we do on 1 October can be billed. So we'll be billed that first day. So it's just a matter of the private insurance and Medicaid and the Medicare with the revenue coming in. So,
I think they told us, from what my notes say, they send out the claims within 24 to 48 hours of us sending them to them. And then Medicare, within 3 weeks, we should see something back from Medicare is what
Correct.
they're estimating, so.
do you want to talk about the interface for the insurance? What they were talking about for the billing company, I'm sorry, of things they provide.
Oh, yeah, sorry, got a lot on my mind today, but, if we decide to go with this company, they'll take our numbers and they'll do all of that stuff, getting everything set up through Blue Cross Blue Shield, Medicare, all of the insurances, so we don't have to apply. They'll do it all for us.
Have you been able to talk to any other service that's used them just as a reference?
No, this is the first I'd heard of it. I don't,
Right.
like Brian said, he got it from the guy who was
Miles
talking.
Brown.
Miles
Yes.
Brown. So we have not, I tried to reach out to Mike Lang and I haven't heard anything back. He's the one from Oskaloosa. I used to work with him years and years ago when Bill and Ray were here. But they will also help us with, they've got some things where you can do, let's see what do they call it? They call it an M-Scholar, and it does like compliance training. You can do everything like on a dashboard, it's lifetime. You can watch from the minute we bill them to the minute they receive it, to the minute and you see it in real time. So you know where our bills are at, where our invoices are with them. And they can do the same thing with charting to where, okay, this individual, they didn't get the signature right, or they needed to get this paperwork. It's real time. And
That's good.
so, I mean, there's a lot of
That will pay
things
for
that
itself.
they can help us
in the long
out.
Exactly.
Yeah.
It will. And with them interfacing with the image trend, and I mentioned image trend because the hospital again uses it,
run.
our volunteers use it,
Mhm. And
so
want
we
to-
could all be on the same page.
Yeah.
And, let's see what else.
Let me talk about supplies.
Yes, and
Okay, I have been working on supplies. What it's going to be to get certain equipment, how much it's gonna be. It's a big dollar figure, just don't get too shocked when I tell you. But we're looking at right now, everything that I've estimated, now mind you, I'm estimating high. There's several different places we can go to besides just Boundtree. I understand Boundtree gives us a percentage off because we're IAMSA members. I'm not figuring that into the total that I've been working on, but right now we're estimating about 256,000. And that's startup, that it will.
That's everything.
That's everything. That's the new power cot that we have to get to replace the one that we don't have for the other rig. That's to get monitors, that's to get vents. That's to get every piece of equipment that we don't have that we need to, plus supplies. And some of those supplies will last us a little bit longer than just the startup.
Before the outdate.
Yeah, before the outdate. Most things that I looked at don't expire for at least a good 2 to 3 years, maybe even further out than that. So I went through and like I said, right now we're looking at 256,000. That doesn't include stuff for office equipment or anything like that. That's just for ambulance.
this doesn't include the grant that I've written for monitors, so, providing I get the grant, that takes off $79,000
Yeah.
right there. Also wanted to say that I'm getting a contract with GSA, which is government surplus, out of Iowa. I've talked to them several times and sent me an application to do it, and we'll get on with them. I'll finish that up today. What that is basically they send me a catalog, if you will, and we can go on there and shop, and it's free. So, and that's just the state of Iowa. So we're gonna get on that. And she said, I forget, Kristen had stated she works with a lot of EMS around the state of Iowa. So they do have EMS equipment available. So what that is, I don't know quite yet. So we just have to get on there, and we can eliminate a lot of this
Potentially.
potentially just by getting on there.
And I also, Libertyville, or not Libertyville, but the EMS Association has been in contact with me, and they're wanting to help out as well. So there's some supplies that they're willing, they're wanting to help us get, so then it's taking cost off of that too. I don't know how much that's gonna be. We're still like in the negotiate, in that process of what they're wanting to spend and what we can purchase, or they're gonna purchase for us to kind of help get things going in the community, so.
Good.
Yep. So we're moving right along.
Yeah.
Things are coming together, billing company wise, licensing wise. So we're ahead of the game, in some aspects, but we're getting there. Again, I'm very thankful we got our MPI. I'm thankful to Chris for working on that and getting it done. She was saying 30 days. I was thinking, oh, we're cutting this close. But I got it that day, so we're good.
Any questions?
So I got,
Go ahead.
I just want to say the one thing about the EMS Association, we want to be what we want to be one Fairfield. I know we have a thing with the school saying one Fairfield. We want to be the one for Jefferson County because we want to be together. That's why we're willing to buy a few things, just because we want to see our county succeed.
And we thank
And we do.
No, like this one.
sir.
so this first question is actually for Dee, to see if she knows the answer to it. The ambulance board entered into an agreement with Stryker for maintenance on. Do we know that the ambulance board paid for that contract? Is it paid for?
I'm pretty sure it is because of that. It must be next week.
The reason I ask that question is because that's something we need to know. My understanding is that, and we'll be discussing this a little later, but on that other ambulance, of course, everything in there is new. And I'm assuming there's a warranty on that Stryker equipment. Fast forwarding with Elizabeth here, and this is really a question for the attorney. I think that we need to go out and take an inventory on the rigs, of the things that.
Lee, it's almost 9 a.m.
Okay, well, it's not yet. So with the rigs and stuff, that we go out, take an inventory and get serial numbers and stuff to make sure that what we had in the beginning is what we get back.
Yeah, we'll have to coordinate that. I think you were talking about when we need to do take the rigs.
We're still
Get
discussing.
those inspected.
Yeah.
Right. That, but we're talking about the cots and
I'm doing
everything.
inventory.
Yeah.
It's 9 a.m.
We get back to that.
And we need to try to do that sooner rather than later. Get that inventory, and we've got a list. I'm gonna give it to Chauncey.
Sure. We also have a work session this afternoon.
That's right.
Okay.
Will they be here, you know?
Who?
The attorneys.
Work session?
Yeah.
I think so. It's time to open the public hearing on proposed plans, specifications, forms of contract, and estimate of cost of proposed public improvement project to wit, emergency services ambulance quarters.
I'll make a motion to open the public hearing.
Second.
I have a motion, a second to open the public hearing. If you could stand by for 1 minute, Shannon's going to go try to find this.
Yeah, well, basically, we need,
Mike on there?
No.
any, comments from the public on Zoom? I'm not seeing anybody on mute.
That's it, right there.
Connor, you can run through that.
Hearing no comments.
Want a motion to close?
Motion, yes.
Motion to close the public hearing.
Motion to close public hearing. By Sandquist, second by Drish. All those in favor signify by saying aye.
Aye.
Good job. To continue with the rest of the agenda, we're just.
Okay. Yep.
The next item is to discuss, consider ambulance purchase. Lee, could we just wait and talk about that at 1 o'clock today?
You don't have the ability to discuss and consider. You can discuss, but you can't
I
consider.
guess we already thought we were gonna buy it.
That's what we need to discuss and consider.
Yeah, I know that. I get that. I'd finally had a conversation and was informed by the mayor that we were getting no money.
I'm not surprised since they haven't talked to you for 12 years.
Well,
My bad.
she was very, and I do understand their thought process. I was told at this time, we don't feel we can release this money because they've got a lot going on. So, and I suppose they do with all the people complaining about the transit time around Fairfield now.
So Chauncey and I and Brian sat down the other day and Judy,
When was this?
Wednesday, Thursday. Well, you were there. We penciled out expenses and in those expenses, we plugged in the 260,000 for the ambulance to
Correct.
see where we would be at overall versus what we had.
And that's one of the reasons I put this on the agenda because Dee wasn't there and she should. be.
Right, and I
Why was
agree.
there-
Well, my question is that we showed roughly 1.78 million in expenses. And because our partner out at the hospital withdrew the $200,000 out of their budget that they were going to appropriate, and evidently they remember the conversation that I don't remember, but that's neither here nor there, because we've been plugging in that $200,000 all along as part of that 1.8 million. Now we're down to 1.6.
You know, I agonize with you as well. The city administrator on his way out was going to give us a whole bunch of money,
Right.
which
But we never put that in. We never
No, we never
considered
got
that.
anything in writing.
never got anything in writing.
So I understand where the city's coming from. All I'm saying is that obviously I perceive the conversation entirely different, and that's fine. It is what it is.
Yeah, and I think they asked Shannon if she could bring to 1 o'clock meeting the updated ARPA money so we know exactly how much we've got. Because I think we need that.
Which goes back to because we talked about the 136,000 in CARES money.
Yeah.
Mhm.
And I'll be honest with you, Dee, I'm not 100% convinced at this point that $51,000 for railroad is high on my list of priorities.
Well, I suggest before you decide, you go drive them home.
Well, if they're gonna put new in, that's the question, you know. So,
I think we got a lot of driving around, looking at things to do, you know, as far as that 51,000 is. You know, you did make me, and I should wait and talk about this afternoon, but I did make me feel good to hear the folks at the ambulance station indicate they weren't gonna start anybody else until September 18th. So that made me think, okay, we don't have to spend that money, you know?
right,
Um,
and we figured way high on the wages and salaries and
Right.
benefits for the
yes.
other folks coming in. I get that, but
Right.
um,
Yeah, that's why I think we just need to see.
there's
it
an additional
penciled out.
110,000 coming out of the ARPA funds that we didn't account for because or 100, yeah. We figured the city and the county was putting in $75,000 apiece
Right.
towards the purchase of that ambulance, and we would put in 110. Now we're gonna have to pony up an additional $150,000.
Mhm.
So, yeah, I think it will help if we have updated figures and then we can
Yeah.
figure it out.
And if you remember, and I'm gonna bring this up, I'm sorry, but I'm gonna bring it up. If you remember, when we sat here and we had the discussion, and I made the motion to ask the other entities in the ambulance board meeting if they would be willing to increase their contribution by $12,000. So nobody sitting in this room evidently heard the same conversation that Brian Hunter expressed the other day.
He talked about that when, I think it was maybe at an advisory committee meeting. It was somewhere.
Yeah, it's hard. There's been so many three-legged next to meetings. It just, Leah's right. I don't remember that, but I'm not sure any of us remember exactly what was said. I don't.
And again, we haven't gotten anything in writing, so.
No. So we just need to deal with the hand we've been dealt.
Yep.
Okay.
Yep.
And proceed forward with a big smile on my face. It's up to you. Smile.
Well, Brian and I and Judy have been working with Chauncey, and we can have that discussion.
Yeah, I just,
later on.
I will tell you, D and I need included in those.
No, I know.
Because it
Yeah,
gives a bad
because-
perception, and none of us need that.
Well, it was just an outgrowth of, it was just an idea that I threw out. He was meeting with Chauncey regarding the contract, which we don't have anything right now. I just felt that there was a need to have an agreement with the hospital regarding transfers. And if you remember, because you both were in the meeting, when Brian made the point that they were spending all of this extra money on transfers and stuff, and they weren't billing anybody. And my heart bleeds for it. But so
no, that's good to get that agreement going.
No, I think
It's just-
anything should be right.
I really tried to involve the whole board in the three-legged stool because I think it's important for.
You know,
to hear
I
these
think how that
discussions.
meeting happened the other day, Brian had called me, so I stopped out. Well, here comes Lee, here comes Chauncey, and they just started talking. It was just very organic. We just started talking about it. But we can follow up with that today and proceed.
perfect.
Now where are we at? Okay, maybe we should, I don't know, should we skip considering, the fiscal year 2024 employee salaries?
This is just a resolution to add the ambulance.
Ryan, you and
Brian
Judy
and
had been
Judy,
left off the
because
resolution,
they
so
were
we
left
thought
off.
we'd add it to.
Last week,
Yes, we discussed that last year.
because it's a new department. So be it resolved, Board of Supervisors, that the following Jefferson County employees be paid the following salaries for pay period effective July 1st. What's the part-time employees will be paid the following amounts?
What?
And it has.
It's just the standard wording.
Oh, okay. Brian Thomas, 3,541.67, Judy Geisel, $2,708.33. Motion to approve.
So moved.
She's, I'll second. I don't know what we just did, but I'll second.
Motion by Sandquist, second by Drew.
There we go,
All those in favor
okay.
said aye.
Aye.
Now, the next is discuss, consider a 2080 for the Mental Health Agency of Southeast Iowa.
Did we get that?
I didn't know they still existed, but this is really
Oh,
nice.
there, we did this. We were trying to be at the front of the bus and get it done early. Well, as you can imagine, when you get 12 attorneys trying to approve something, there's some wordsmithing, so nothing major has changed. I know Elizabeth had questions and she called Ryan and got hers answered, so.
Elizabeth did say minimal changes, code citations.
Yep. So, once again, motion to approve this and to have the chair sign this, please. And I need to take it Wednesday to the meeting.
I'll second that. discussion before we vote on the motion.
Okay.
I know we're bringing in 3 or 4 new ones.
Four.
4 new ones.
Possibly 5 in Monroe.
We are the
22.
westernmost part of that region. that new
We're
region.
we're in the middle now, so we're gonna start having our meetings in Fairfield. It used to be in Mount Pleasant
Really?
because we were a part of the 8 counties southeast of here, and we were on the west edge. Now we're adding
Haskell,
Wapello,
Davis, and
Davis, Mahaska, and Avenues. And then Monroe's also interested, but I'm not.
so who becomes the fiscal agent?
Des Moines County still didn't do it.
And then the other question I have is that, and I'm grateful for Elizabeth, she said minimal changes. So I'm assuming then from that Mahaska, Monroe, Wapello, and Davis have, and Avenues have acquiesced to what we do rather than us acquiescing to what they do.
We're working together on it. We've had 2 meetings together in transition. And so Jack Seward, well, we just so far until we get official, we elected interim officers. So Jack's the chair, and then Lon from Davis County. So we're trying to work that together. Now the challenge coming up, and this is with all the mental health, is because of the changes in the state law. All the supervisors will no longer have a vote because the legislature deemed that we could only have 49% of the vote since we don't fund it anymore. So we'll wait and see we haven't determined who's going to be on the governance board going forward. We'll do that probably either this month or in July.
Can I make a suggestion? I don't know that it's legal. I don't know that the state has thought about it in this context, but on the CETA board, you have private and
That's what we're going to do.
what's the other word? Susie is private and obviously the government of the supervisors, and then there's one other entity. I don't want to say underprivileged, that's not what they call it.
Right, but yes.
Low income.
Low, yeah.
Well,
So supervisor could be a private.
right. It's kind of like,
Or low income.
there's different criteria. Like now we have an adult.
Oh, we have adults, okay.
An adult
We're going downhill now.
advisory committee person on, and we have a child, children's behavioral health. So those are already
I was
members.
just thinking to boost the supervisors up to
No,
51%.
That happens on some other boards. So, yeah,
So do we need to have in your motion to authorize the chair to sign it or just?
yes, I would, well, yeah.
That was part of her motion.
Okay, was it? Okay, good.
And
Are we ready to vote?
Been waiting on you for an hour.
All those in favor, signify by saying aye.
hi. So after these, if you could get them signed maybe this morning, and you could get them this afternoon.
Shannon.
Thank you.
Thank you once again.
Could have been done sooner,
And we're
except
actually-
Susie was dragging her feet.
We're gonna have our meetings now that they're in Fairfield at the well, so that'll be
Oh,
fun to get there.
yeah, yeah. I had a tour of that the other day. Were you on that tour?
No, I was gonna go.
This
on
one,
with
this one does that.
Quite the place, actually. Huge.
What's this?
Well,
the well.
Oh, right.
man, oh man, I'm telling you, you could roller skate in a buffalo herd up there.
Used to be a daycare center out there.
Yeah,
Yeah,
yeah.
I went out there to visit the daycare when I
We
was.
used to walk all the
since
kids
7.
upstairs. Just kidding.
All righty,
I don't know.
where are we?
I didn't read the fine print. We're now, first off, we really need to find a taller person to change the count, the time on that clock. Having none, it's time to make committee reports.
I think,
Oh, Susie. Yeah. Must be Monday.
It is.
Okay. Well, we're good. We're on the same page then. Scary, isn't it?
Mm-hmm.
Well, I had a DCAT meeting that I missed.
You know, I feel bad
I do because,
because they're undergoing some changes too, I understand.
yes, and
Like funding.
Are they?
thank you, Susie.
So what's going on?
Now we got
Well,
something
evidently, the state of Iowa, in its infinite wisdom, from Director, Department of Health and Human Services, which is the new thing, right? They recently have been in, Juvenile Court Services has recently been informed by HHS that they have been instructed to refuse to sign any DCAT contracts which would utilize FY24 funds transferred to a DCAT project by Juvenile Court Services. I've not been to enough DCAT meetings to be able to expand upon this in any great detail, but suffice it to say that Chad Jensen, the Director of Juvenile Court Services, indicated that the areas that would be affected would be services targeting youth at risk of involvement would be disrupted or cease. Youth and families currently receiving services would see a disruption or could abruptly end. Community safety would be jeopardized due to the loss of preventative services. Staff providing preventative community-based services would lose their jobs. Local programming targeted to specific youth populations would be disrupted or ceased. Youth referred group programs, pilot projects would no longer be possible. Programs that target youth that cross over between two systems, ensuring continuity of service, would cease. HHS and community referrals to JCS funded programming would cease. And the other issue is, at least as I see it, a lot of these funds, I'm a short timer here on DCAT, but a lot of these funds have already been approved by the DCAT boards. And because of the late timing of this.
And I'm guessing that has to do with the merger departments at the state level. Possibly because when I was on DCAT, a lot of that funding, and that's been a few years, and back then it was a significant part of their funding.
And to point out for the public that decategorization is what it is. The DCAT was created by statute. A 30-year history of supporting community-based preventive services. And I think you're right, Dee. I think that this is in part maybe having something to do with the combination, but I don't understand, quite frankly. I don't know if they're clawing back this money because it doesn't say in this document. It just says that have been instructed to refuse to sign any contracts with DCAT, which would utilize FY24 funds transferred to any DCAT project by Juvenile Court Services. We just did this the other day.
I think that's very unfortunate.
Why don't we reach out to Troy Seeley, because that's his thing, and ask him to come and give us an update sometime.
Well, I can certainly do that. I do know that it was at his request, the last meeting that I attended, that we transferred funds. Now, it wasn't, I mean, it was funds we had, it was in the budget, so to speak. But you know how, you both know, you've been there, you know how that works. So how this all comes out in the wash, I don't know yet.
Because I know what's going on in some other
And
committees.
Chris is very, very up on this as well.
Yeah, I think it probably has to do with some of the services now being under DHS rather than where they were before. And so maybe they'll be provided through that umbrella, but I'm guessing Troy would have the.
And see, and I don't know where Pat, because it says here also that, I mean, obviously that's his world right now. It has been for quite a while, but I mean, and I think probably the timing of it, not that it would ever be necessarily a good thing, but the timing of it and the short notice also, because these DCATs have already budgeted for this stuff and have implemented these things, and now they have the rug jerked out. So.
Yeah, I would suggest we need to be better informed with this. Maybe just ask Troy or Tammy to come and talk.
Yeah.
You know, Because I.
maybe in a couple of weeks.
Moving on, well, I guess I went to the three-legged milk stool meeting.
Too, and we already kind of talked about that.
And the cow was dry.
Yep.
It wasn't even in the barn.
Okay.
I also helped maybe at the chamber a little bit on Thursday night at the party, the
Yes.
blast off thing. At 6:30 in the morning when the
Did you
country club
play?
didn't know.
No.
At 6:30 in the morning when the country club wasn't open yet, so maybe you could get in. I think I helped pacify her for the next hour till they got there.
Work in the bar?
No,
No.
couldn't get in the building, couldn't get in the building.
Oh, okay.
But it was nice. It was fun.
So I talked to Brett, he was playing in that, Farrell.
Yes, I saw him Thursday night.
And I talked to him on the phone a little bit and about an address situation and I said, are you winning? He goes, oh, no. He says, I don't care. I said, well, if you ever want to play golf where you can beat the socks off of somebody, give me a call because I haven't never swung a golf club. So we're all good.
You know, I think they all had a good time. I'm pretty concerned there's a lot of sore elbows.
Well,
You
yeah.
know,
And when it's just one direction all the time.
I know.
Yeah.
And so that's it for the other one.
Welcome back, Connor.
Okay, we need, have you looked at the claims? Because we need to look at them and approve them. I have already done that. You grab that from me. Thank you.
Motion to allow claims and approve reports. She's looking.
So moved.
All those in favor?
Aye.
Aye.
I'm kind of waiting for you to speed it up there.
Yeah, I need to go.
Oh, you gotta love it, right?
All right, motion to adjourn.
Okay. Till 1 o'clock.
Motion to
Well, that's a
adjourn by
work
Sandquist,
session.
second by Sandquist. One today. All those in favor?
Aye.